Hello, my name is DeAndrea Bolden, and you are tuned into the Faith and Mental Health Podcast. Today, as always, I have another amazing guest. I'm really excited to have her on today. I found her on social media. Man, I don't know. It's been a while. I've been following her for a while on social media. I silently stalked several people, but I've been following her and I decided to reach out and shoot my shot and see if I can get her on the podcast. And I'm just honored to have her today. And so, as always, I'm going to allow her to introduce herself to our listeners.
Wonderful. Thank you so much for having me. I'm excited for the conversation. I'm Dr. Thema Bryant. I'm a licensed psychologist and ordained minister in the African Methodist Episcopal Church and a sacred artist through dance and spoken word poetry. I'm also a daughter, a mother, a friend, a sister, a community advocate, activist, particularly around mental health access, quality mental health. And I am blessed to really be a bridge between the faith communities and the mental health communities, which is right in alignment with the work that you do.
Yeah. I love it. Listen. And so I listen. I want to take a minute and I want to talk a little bit more about what you do with the intersection in faith and mental health. Of course, that's something that for those that follow the podcast and follow me, know that's something that I've been doing now for probably over 10 years. And so I have gotten the saints have about tarred and feathered me. Listen, you know how I can get, we
Yes.
don't need nothing but Jesus. They about to rub me out the church. I'm just trying to give folks some help. But
Yes.
I want to talk a little bit more about before we get into other things. I want to talk a little bit more because I want to, guys. I have to tell you, I need y'all to go to her website, drthema.com,
DrThema.com. Yes.
DrThema.com, because she's being beyond humble right now. Her credentials is standing 10 toes down, and so I want to talk a little bit more about your professional work, and then I want to get a little bit more into what you do from an integrative standpoint. But I love what you were doing. I know that you're not in that capacity anymore, but being the president of the APA is amazing. Having that type of influence over the world of psychology matters. Having that influence as a Black woman, I think it matters. Because it's statistically proven and it's shown that a lot of research that is done excludes us. And so when you look at, I remember when I was in undergrad, even when you look at something as simple as ADHD, when they were doing the assessments and stuff, I was doing research and I was like, a lot of these assessments aren't clinically sensitive to those that are from different cultural backgrounds. And so some things that would be flagged as probably being, a potential symptom is just cultural norms. And so I love that. So I want to talk a little bit about what you do professionally because you are a psychologist. And so I think that matters. The work you've done, even the stuff you were doing globally. I saw that you were kind of like the ambassador for the APA for the United Nations. I almost flipped this laptop over. I said, now come on. So I want to talk a little bit more about what you do professionally. I want to talk about a little bit, get more into, we'll get back to the faith and mental health piece. And then we have to talk about this amazing book that you just released last month. I believe it was February 25th.
February 4th.
February 4th. Okay,
Yes.
February
Yes.
4th. All right. So
Yes.
I'm gonna be quiet. So tune in, everyone. Listen.
Thank you so much. I am so grateful for the various opportunities that I've had. And one of them, as you mentioned, was being the 2023 president of the American Psychological Association. It's an organization of over 150,000 mental health professionals. I was the sixth Black woman, and I was the youngest ever elected president. And I am in the organization's over 100-year history, only the second minister to serve in that role. And so being both a minister and a psychologist, for some people, understandably created some anxiety. Because some people's experience with Christians has not been edifying or respectful or
Yeah.
inclusive. And so it was important for me to be a different example of what it looks like for us to show up grounded in our faith and welcoming to all people, and appreciative to all people and their paths and traditions. And so my area of expertise is in trauma recovery. And so that's a key way in which I integrate people's spirituality, their religion, their faith, as a coping and healing resource. And as you named, for people who don't have exposure to a faith tradition, or who are not grounded in one, there can be a tendency to pathologize, to look at those experiences in a negative light. So there is a term, hyper religiosity.
Yeah.
Hyper religiosity is very subjective, and it basically means that you engage with your faith in a way that is more than I feel comfortable, right? And so they will, let's say if you have a therapist who doesn't go to church at all and you go twice a week, to them that might sound hyper religious. If you have a therapist who doesn't have a prayer life and you pray before you make major decisions, they might call that hyper religious. And so a part of the work that I do is educating mental health professionals, so that there is a greater understanding and respect for the range of experiences as it relates to faith. Now, of course, we do know that some faith traditions have been used to abuse, to
Yes.
oppress, and to silence, and we have to be
Yes.
willing to acknowledge that. And then on the other end of the spectrum, for some people, they would not have survived without their faith. And
Mm-hmm.
so it can be a blessing for some, a burden for others, and for some people, both. When you have church hurt and yet still believe. So we want to uh, have mental health professionals who are prepared and equipped to provide care in a relevant way. And so I'm a professor at Pepperdine University in our graduate school. So training and supervising those who are at the master's level and at the doctoral level. I teach our multicultural psychology class. So in addition to looking at things like race and gender and migration status, we also look at religion, spirituality, and faith. For many people, it frames the way they look at life, the way they understand themselves, the way they understand their problems. And so to erase it or to deny it is not to see the whole person. I also let them know that women and people of color endorse higher levels of spirituality. So when we pathologize that or ignore that, who is it that we are disserving? Those who are already marginalized and minoritized. So there is definitely work to do to equip therapists to be ready. So for example, I had a graduate student who came to me in great concern because she had a client who said she was fasting. The therapist wasn't familiar with fasting, so she wanted to know, is it an eating disorder, and how she should approach it and how she should understand it. So there is work to be done to create better understanding and knowledge among mental health professionals.
Okay.
On the other end, there is definite work to be done within faith communities so
Mhm.
that people are not forced to make a choice to say, like, you don't need therapy, you just need to pray about it. It's a
Right.
false choice. So I say to people, if you're having a flood in your basement, do you call the plumber or do you just take it to Jesus? Right? So we call the plumber. If you have a toothache, do you just lay holy hands or you go on and get that filling? So, we want to be reasonable and acknowledge that God can bring healing in many different avenues. And
Okay.
one of the pathways that God has used to do healing, emotional healing, is through therapy and through counseling. And we also want to acknowledge, and I have a master's in divinity, that most of our ministers uh, do not in those degree programs get equipped. So in my
Yeah.
master's of divinity, there was one semester course on pastoral care and counseling, and the entire semester focused on grief and loss. Now, grief and loss are very important Every pastor
Mhm.
is going to have to do a funeral at some point. You want to
Yeah.
comfort the family. All of those things are essential. But I want to say in that one semester, there was no mention of bipolar disorder, no mention
Yeah.
of schizophrenia, no mention of child abuse, no mention of sexual assault. And
Yeah.
so then to say that this person has to be in charge of the mental health of their congregation is problematic. It
Yeah.
disserves our congregants, and it's a setup also for the minister to make them an expert on things they have no knowledge of.
That's really, really good. You can I was baffled when you said one of your colleagues came to you because somebody was fasting. I'm like, you could have Googled that. Like your doctors never told you to do fasting blood work. Like this is it's okay. So
Yeah.
moving on.
Yes.
But I love what you were talking about with pastors. I do think it's important for clergy to have some type of training when as it pertains to mental health, so that they're in a better position to be able to meet the needs of their congregation, not expecting them to be the one to diagnose and treat unless they are, a clinical a clinician, but
Mhm.
at least be prepared to have referrals, to recognize the signs of mental health issues, to be able to make people feel safe and not ostracized or embarrassed or stigmatized. Um, and to be able to recommend to people that it's okay to get professional mental health treatment. That's one thing my church promotes heavily is listen, folks, I do it for a lot of different ministries, and I'm still working on the directory for faith and mental health because I'm constantly having people asking, where can I go to get help, and where can I go to get treatment, and I want to go and see a therapist and things like that. And so yeah, it definitely it's real. I had a guy on, he was a guest on the podcast and he was a speaker at my annual Faith and Mental Health Summit a couple years ago. He was one of my virtual speakers. His name is Dr. Matthew Stanford. He believe he's out at Baylor University. But I love what he was giving. He wrote a book called Grace and Madness, and I loved it. I was tickled by some of the stuff in there. Like I'll laugh and he's like serious. I laugh a lot. I can't help it. But I like some of the statistics how he was talking about when a person is having a mental health crisis, even if they are not a believer, they are most prone to go and seek out a pastor. And I found that very interesting, that even when people don't believe, when their mental health is in a bad space, they're like, let me go and find. So that's another reason why it's important for the church to be equipped. But I love the work you said you were doing with with clinicians and your peers and those that provide care, that you can't. I think it's important for us. I want to take a step back because I'm just excited. I think it's important for us to realize a lot of things are subjective. And so just like you were talking about with hyper religiosity, and I'm very aware of what that is, and with that being subjective, you're right. People have to make sure that they're not being biased when your client may adhere to a certain faith or a certain religion or certain spiritual beliefs and practices. You don't want to be biased or stigmatize them because you're looking at it through your lens of not being familiar with that or not being connected to that faith or religious community. And so I love that you're doing that because there is a lot of pushback. I get a lot of pushback. Like I have so many people that are angry that I do faith and mental health. I remember a friend of mine, she was a speaker at a government level in her state. I won't give name or state. They had to get security because people were putting threats against her because she was going to be talking about faith and mental health. And so there's a lot of pushback against it. And so I'm very grateful for people like you that are out there doing the work to try to educate those that are in the mental health practice, that are seeing clients, to help them have a better understanding of what it means when somebody is a believer or whatever their spiritual walk or religious or faith path is, to understand that you need to respect that because that's a part of who they are as a person. That's a part of their worldview. That's a part of their perspective. That's a part of their grounding as a human being. And so I love that you're doing that. I love the work that you're doing in the area. And then I'm grateful even for what you try to do to help educate the church. The church can be very obstinate, stiff-necked, stubborn when it comes to embracing and even being open to mental health. I've had to explain to people that these people are not going to school all these years and getting degrees and know nothing. And because you know a couple scriptures, your knowledge surpasses theirs. It's like you can't go to the Mayo Clinic and argue with them with a Bible in your hand. They're going to say, okay, let's go degree for degree, credential for credential. And so I think I've had to explain to people. I think one thing I find a lot of people don't understand that there's actually a criteria for mental health diagnosis. A lot of people have never heard of the DSM-5. They don't understand where this stuff is coming from. They don't understand where these diagnoses are coming from. They don't understand the different type of, I try to explain to people the different type of mental health practitioners are out there, the difference between a psychiatrist being a medical doctor and a psychologist being a person that specializes in they may do things first as far as assessing, treating, diagnosing, talk therapy, and different things like that. And so there's just a lot of information, a lot of lack of knowledge in the church. But I want to give you breath to, I know I got to run in my mouth. I'm so excited because I get excited when talking about faith and mental health. And so I want to
I
I
want
want to
to
kind of
also
go
connect
ahead.
with the point you were making about the importance of preparing ministers. I was grateful that an organization that has a grant to particularly serve early career pastors, and they brought me in to do a day-long training on partner abuse and the ways in which the church should respond. And it was remarkable because many of the ministers had not heard of nor had an understanding of emotional abuse,
Yeah.
or psychological abuse, and also had not recognized the ways in which it can be problematic to just pray for people and send them home. So
Yeah,
that is not undermining or dismissing the power of prayer, but also
exactly.
saying how it is unethical and insufficient to tell someone to submit and go home to someone who is not transformed. And
Good.
that too many times we have prioritized the saving of a union to the destruction of the individuals in the union. And so that training is vital.
That was good. Prioritizing saving a union while the individual, especially the
Mhm.
person being abused in the
Yes.
relationship, is being destroyed. That is
Right?
very true.
Because
Telling people to,
we cheer for the number of years, staying up 10 years, 20 years,
that's
and
true.
we're cheering and have no care for the state of the people in it. I
Yes.
even heard a minister saying, like, chastising people for wanting to be happy. They said, where in the Bible is happiness associated with marriage? You don't need to be happy. I was like, what
Wow.
in the world are we promoting here? So we promote long suffering, that's biblical, but your joy is not.
Wow. That's a good one. That's good. No, I
Right?
thank you for saying that because there's so much room for how the church needs to respond to different situations and
Yeah.
different scenarios. And I think that what you brought to light is that, a lot of times when pastors may go to seminary and different things, they're being well taught and well trained in the word, sorry, in the
Mhm,
word,
mhm.
but they're not getting some of the other necessary
Yeah.
training they need to actually be able to deal with the people. So
Right.
beyond the sermon, how do you
Yeah.
handle a mental health crisis? What do you do?
Mhm, mhm.
What do you do, like you said, when somebody is found to be in an abusive relationship? What do you
Yeah.
do when children are being abused? What do you
Yeah.
do when you find out someone is addicted? And I did substance abuse counseling for several years. What do you do when someone is suicidal? All these
Mhm,
different scenarios where we're preparing people to be good sermon providers, but
mhm.
not equipping them to be able to deal with the realities of ministry, which is the reality of dealing with people that many
Yes.
times are broken.
Right.
But I want to segue and I want to talk to talk about this amazing book. Listen, to those that are tuned in, I'm talking to Dr. Thema Bryant, and we have been talking a little bit about faith and mental health. I've been rambling. You know, I get excited, guys. But I want to talk about her book. She launched an amazing book last month, February 4th. And the book is titled Matters of the Heart: Healing Your Relationship with Yourself and Those You Love. The reason why this book and the title stuck out to me is because so many people struggle, with building and maintaining healthy relationships. This is whether it's family relationships, romantic relationships, even friendships. A lot of people do not know how to handle people because they're so hurt and wounded themselves. And so this one is talking about, if you, because I believe what she's saying is that that title is amazing, because if you can deal with what's going on with you, it lets us better handle other people. We will value and treasure relationships more. We won't be so quick to cut everybody off for every little thing. We'll give people a little more grace. I find that when we're hard on ourselves, we're hard on others. And so I want her to talk about this book because, like I said, I plan on getting this myself, because I don't think we understand how important relationships are. And I do believe that in certain uh cultures and in certain subcultures and communities, we've lost the importance and the value and the sacredness of certain relationships, and the value that we should have with that connection to other people. And you find people, I don't need nobody, and I cut everybody off, and it's like that. We're not meant to live alone. We're meant to live in community. In order to live in community, we have to be able to love and trust other people, and to be able to get along and interact well with others. Like how they say with little kids, do you play well with others? But I want her to talk about this book because I believe this book is going to change a lot of lives. I believe that emotional intelligence and different things like that are lacking in a lot of people. And I believe that her clinical expertise, her role as a minister, and her life experience has given her the ability to stand 10 toes down on this book and topic and really feed people the wisdom they need to be healthier as an individual and in their relationships. So, Dr. Thema, tell us all about this book.
Yes, thank you so much. So the book is called Matters of the Heart. It hit the shelves in February and immediately was a bestseller. Is a bestseller in clinical psychology, and it equips us with the importance of healing our relationship with ourselves and others. In terms of your relationship with yourself, it's important that we move away from self-abandonment and self-neglect and begin to take better care of ourselves, to honor ourselves, nourish ourselves in the ways that we treat ourselves, including setting boundaries, getting rest, in terms of our nutrition, in terms of our ability to say no when we need to say no, so that we can say yes to our mental health and peace. And then in the second section of the book, it gives key aspects for healthy friendships and healthy romantic relationships, whether we're talking about our own self-care, being a loving and a kind person, being gentle instead of being harsh, releasing tendencies toward controlling, and instead embracing and affirming. And then in the last section of the book, it talks about dealing with challenges that can come up, whether it's healing and repairing a rupture in a friendship, healing after infidelity in a marriage or in a romantic relationship, releasing someone who doesn't love you so that you are not holding on to a fantasy or breadcrumbs, so that we can flourish and have really loving, mutual and reciprocal loving relationships. Each chapter ends with an affirmation so we can begin speaking truth and life to ourselves. I want to say that for those who are not necessarily into reading books, that there is an audio book. And I am the voice on the recording, so you can get the audio version, the digital version, or the hardcover. As we shared, my website is drthema.com. The book is available on Barnes and Nobles, Amazon, wherever books are sold, including your local independent booksellers who we always want to support. I want to share with you as we prepare to close that those in the California area or nearby, on May 11th, the day before Mother's Day, I'm doing a day-long retreat in San Diego. It is for mothers and godmothers, for people of any gender who are grieving the loss of a mother, or for those who have complicated relationships with their mothers. I invite you to come and do this day of healing with me. For the registration, you can email me at support@drthema.com. Support@drthema.com. I also forgot to mention I have a podcast as well called the Homecoming Podcast, and it's available on YouTube, iTunes, Spotify, and SoundCloud. And I would love for you to join me for those weekly episodes on our mental health. I want to say thank you so much for this time and allowing me to sharing about the book and this important bridge so that we can be well holistically, mind, body, heart, and spirit.
Awesome, awesome, awesome. I want to say thank you again to Dr. Thema for joining me today. I do want to mention, because she's so humble, she does have other books. So go to her website and check out her other books. She is not a one-time author. She is a multiple-time author. So I want you to check that out. And I want to say thank you for that retreat. I have to say this before we close, because I wrote a blog either a year or two ago about how Mother's Day was not a happy day for everyone, whether it's a mother they never knew, a mother they lost, the mother relationship they will never have, people that have lost children, just the whole, those that were infertile and couldn't have children. Mother's Day is a big day, a big emotional day for a lot of people. And for a lot of people, it's not a good one. So thank you
Yes,
for
you're
seeing that.
welcome.
Thank you for seeing that and recognizing the pain that a lot of people deal with annually during Mother's Day. And I have some people I do want to share it. And so I don't know if you're going to do anything virtual, because I do know some people that could benefit from that, but may not be in a financial capacity to join you in California, because I'm
Yeah.
based out of the Midwest. I'm in Michigan. And
Okay.
so, but I do want to see what I can find about this and share it. And if you do have anything else, whether it's a podcast on this or a blog or anything that you want to share that will be encouraging for those that are grieving during Mother's Day, please let me know. I would love to share that. And so thank you again to Dr. Thema for being my guest. Thank you for those that tuned in. God bless you. And as always, until next time.